Have you heard the commercials that say if you took a certain drug while you were pregnant and your baby was born with birth defects, then you may be entitled to a claim? These commercials do not have to apply to you. By simply avoiding all types of drugs, you are greatly increasing the probability that you will have a healthy baby. The effects of alcohol, prescription drugs, and illegal drugs on pregnant women are highly dangerous to not only themselves, but also their developing babies. Caffeine and tobacco also pose serious risks to unborn children. The simple answer to these recurring problems is to avoid harmful substances and drugs during pregnancy, and always ask your doctor before taking any medications or herbal substitutes. Consuming alcohol during pregnancy can cause fetal alcohol syndrome. Fetal alcohol syndrome is one of the leading preventable causes of mental retardation. According to the Developing Child, 1 in 5 babies diagnosed with fetal alcohol syndrome do not live past 1 year old. Effects of fetal alcohol syndrome include delayed physical growth, organ defects, hyperactivity, and facial deformity. Other than physical defects, victims suffer from difficulties with learning, attention, memory, or problem solving. Other common problems include poor coordination and difficulty controlling behavior. Alcohol is not the only drug that can harm developing babies. Prescription and over-the-counter drugs also pose many threats to pregnant women and their growing babies. Prescription and over-the-counter drugs can get into a baby's bloodstream and cause numerous developmental problems. Consuming medications during pregnancy can cause birth defects, addiction, and other problems. There is no such thing as a completely safe drug for a developing fetus. Some chemicals found in medications can cause severe harm, including mental retardation, slow growth, infections, or bleeding at birth. Other over-the-counter medications are just as dangerous as prescription medications. Even a medication as harmless as an antacid can harm a fetus. According to the book The Developing Child, expectant mothers should check with a physician before using any type of medication, vitamin, or herbal supplement. If legal drugs are harmful to developing babies, imagine the damaging defects that illegal drugs can have on them. Illegal drugs are dangerous for everyone, especially for pregnant women. Not only are they endangering themselves, but they are endangering their unborn babies. Illegal drugs include cocaine, marijuana, methamphetamine, and other illegal substances. All of the drugs that a mother puts into her bloodstream pass through the tissue that connects to the baby, or the placenta, and into the developing baby. Thus, a mother passes her addiction to a drug onto the baby. Infants with an inherited drug addiction go through a painful period of withdrawal directly after birth. Babies that survive the withdrawal period typically suffer from learning and behavioral difficulties. Another illegal drug is cocaine. Cocaine is proven to increase the risk of miscarriage, stillbirth, and premature birth. According to the book The Developing Child, fetuses exposed to cocaine tend to have low birth weight, smaller heads than other newborns, and a higher risk of seizures and SIDS, sudden infant death syndrome. They may also have tremors, exaggerated startle response, sleep and feeding difficulties, irritability, and developmental delay. Marijuana and methamphetamine use are linked to low birth weight, premature delivery, breathing difficulties, poor attention span, drowsiness, and heart defects. These serious defects can become completely extinct by staying away from illegal drugs and avoiding contact with people that use them. Serious drugs are not only harmful substances that pregnant women should stay away from. Caffeine and tobacco are also considered drugs. These substances have damaging effects on unborn babies. Caffeine is found in beverages such as coffee, tea, and soft drinks. These are beverages that many people consume on a daily basis. Caffeine passes easily from the mother to the baby, causing the baby to have higher levels of caffeine than the mother because of its immature immune metabolism. Small amounts of caffeine do not appear to pose great pregnancy risks. However, larger quantities are associated with prenatal problems, such as miscarriage, premature birth, and low birth weight. Tobacco is another drug women should be aware of. The nicotine in tobacco is harmful to any person, especially an unborn child. Smoking causes low birth weights and premature birth. Birth weight is critical to a baby's survival. Low birth weight may cause serious health problems. Secondhand smoke is also harmful. According to your book, Your Pregnancy and Childbirth Month to Month, Partners, coworkers, or friends that smoke should either quit smoking or avoid smoking around pregnant women. Pregnant women should stay away from hazardous environments, including places where people are smoking or using hazardous chemicals. There is no drug, legal or illegal, that is safe for an unborn baby. The effects of alcohol, prescription and over-the-counter drugs, illegal drugs, caffeine, and tobacco are all life-threatening. This is an issue in the United States that can be prevented. By informing the public of this problem, it can be stopped altogether. No more children have to suffer from their mother's poor choices if their mothers do not make poor choices. Gandhi once said, "Be the change you wish to see in the world." The change starts with us. Make good choices and take care of your unborn children. Thank you.